and welcome to the August 5th, 2019 Grafton Board of Health meeting. Motion to open.
I will make a motion to open the meeting.
Second.
All in favor?
Aye.
Aye.
All right, first on the agenda is the Alliance update.
All right, so we'll start with just the monthly update that goes out to everybody. A couple things to highlight for you. On October 16th at 12:30, that's our next quarterly Alliance meeting. It will be in Millbury. The agenda will be coming out shortly, but a lot of the discussion will be around vaping and cannabis use. The meeting that we just had in July, we actually had a really good turnout. Deb was able to come, which was great, and I think Marianne was there as well.
Marianne and I were both there.
And that was all about emergency dispensing site planning. So I think there was great discussion from that, and certainly feel free, any follow-up, to contact Alyssa in our office, and we can do any follow-up from that meeting. Also, regarding ticks and mosquitoes, just remember to keep promoting, and I believe Nancy put stuff on the website already, and you guys have flyers too. We got a HON alert today that I think triple E risk has been heightened in some communities. Grafton is not one of them. Also, the Academic Health Collaborative is recruiting fall interns. So if you within health or just from talking to others in the town hall, if anyone's looking for any interns, please let us know. And certainly, public health crosses a lot of different areas besides just the Board of Health office. So let us know if you know anybody that's looking for interns so we can try to match you up with somebody. A couple other quick things. There was a Coalition for Healthy Grafton meeting back on July 31st that some of our staff attended. It looks like they're working on a couple different substance use prevention initiatives for the fall. A youth-led sticker shock campaign, a youth social norms campaign, and then the event that's coming up on September 24th with Dr. Ruth Potier. Which has been very good. We've done that in other communities as well in the Alliance, and has been very well received. So that's coming up on September 24th. Tomorrow's National Night Out. We will have a table here for public health for that event. There are a couple blood pressure clinics coming up. So the usual one at the Grafton Housing Authority and one at the Senior Center. They're both monthly. And it sounds like the July 10th shingles vaccine clinic was another success. 32 doses were administered for that.
Oh, excuse me.
Yes.
Where is that Dr. Ruth Pote?
It is on,
High
let's see.
school.
It's on the
Not
second
at the high
page.
school, yeah.
Yeah, right here.
Yeah, top of
She's
page
an
2.
excellent. She's an excellent speaker.
Right.
Yeah, we've
She does
gotten
a
really
really
good
nice.
feedback.
She does a really nice
Yep.
job.
Yep. Before I move on, does anyone have any questions on the update itself? All right. Also, Phil provided an update on inspections. The only inspection from June and July that is outstanding is Zia's Kitchen. It's a residential kitchen. She makes biscottis, and they're still trying to schedule a convenient time to come out and do that one. Otherwise, all other June and July have been completed, and half of August has been completed. Phil is in the office several times a week, especially for Title V, doing that and scheduling as appropriate. For that, I think Nancy actually, when they schedule it, Nancy does a calendar invite, so Nancy and Phil both know the time for that. There was one housing complaint that's been closed out at 43 John Drive in July. There was an FS Stars recreational camp in July, but they actually canceled it last minute, so it did not end up occurring due to lack of enrollment. It was going to be at the Lions Club soccer field. In terms of coverage, Phil and Julie will still be the main points of coverage until we hire someone. The position has closed, so we're looking through resumes right now, and then should be starting the interview process shortly. So that's moving. It's a good sign that the position closed. Lastly, for you, I attended the monthly IBC meeting at Tufts. Another good meeting, no issues, being a combined Boston, Medford, Grafton meeting. They did have one potential question that Julie's looking into to get more information on regarding water filtration of some of their different labs at the facility. So I'm hoping this week to schedule a call with John, who's the biosafety officer in Grafton, and with Julie as well, so that they speak the lingo more than I speak the lingo, to get us on the same page to see exactly what Tufts would be looking to ask for, and then hopefully I'll have something to bring back to you next meeting.
Okay.
Okay.
Any other questions for me on anything?
There are two community representatives still in that committee, correct?
Correct.
From Grafton?
Yes. So the two community representatives have voting authority, so they vote. And then I am there representing the Board of Health, so I can't vote, but I'm there to listen to conversation. If they have questions, if you guys ever have questions, I
Yeah.
can be that liaison between the two.
And is it televised or somehow, how do the folks from Somerville connect?
We do video
Do
conferencing.
video
Yeah,
conferencing, yeah.
Yeah,
that's how
it
they do
actually
now.
works. I was a little skeptical just in terms of, we tried in our office and technology never works, but their technology works quite well. We've had no problems past few meetings.
Yep.
So it's worked out well.
That's great.
Yeah.
That's all good.
You good? Any questions?
No.
All right.
All right. Thank you.
Thanks.
Sure.
Sure, no need to wait to 6:15 if you don't want, unless you want to hang around for like 8 extra minutes.
Thank you for inviting me. I'm Mary Ann DeVries. I'm the new MRC coordinator for Greater Grafton MRC. Currently, I have full-time position at the Grafton Police Department. I've been there going on 20 years. I do EMD, I am the emergency dispatch. Also, I do the Q&A for dispatchers to make sure they follow the policies and procedures that we have in place. So far in this position, I've made 2 meetings, the GMA meeting and the emergency preparedness meeting. I have provided volunteers for the shingles clinic, the National Night Out tomorrow. And I'm reviewing the website. I had to create a new Facebook page because the other Facebook page was attached to Lindsay's, so
Okay.
that will be going up like tomorrow.
Yeah, Facebook has their little
Exactly.
nuances, shall we
Exactly.
say, with
And I've
transferring
made connections with Liz Foley, a couple other people in that area for, help to get acclimated to the position. So,
things. Oh yeah, there's a lot to take in.
exactly. Yep.
What can you tell us about the meeting that's supposed to be next Monday
Next
at
Monday.
4 o'clock on the 12th?
That's
With the
going
other
to be-
MRCs?
Yep. That's going to be an introduction with the 16 communities that are involved in the Greater Grafton MRC, to introduce myself and to get a feel for what they need in their community in terms of what they feel would be good for training, volunteer, reaching out for volunteers, and making contacts with whomever is in that community for the MRC contact.
So is it with the Board of Health, or was it the town administrators, or who was it with?
It's both.
Okay.
Both Board of Health and town administrators were invited.
Was the Grafton Board of Health invited to that?
I didn't get anything.
I didn't get anything. Did anybody get anything?
Not me. Not yet.
You
So-
will then.
Yeah, I think we just wanted you to know what our expectations have
Sure.
been. And I think it's fairly simple. And quarterly, I think we would ask to get, an update on what you've been dealing with in terms of achievements and deliverables.
Sure.
And the plans for the next quarter.
Yep,
type
definitely.
of thing.
Yep.
Any hiccups you're running into,
Exactly.
any way we
And
can
anything
assist,
that you guys can
obviously.
provide to me in terms of what you would hope to have for training would be great too. So I
Yeah.
can look into that and provide that also.
How was the response to the National Night Out in terms of volunteers? Did you
I
get
have
enough?
3
Okay.
volunteers.
Any from the outside towns?
No,
No. So we really need to do something to
right.
get.
And the thing with the volunteers, I mean, we have, I think, 199
Yeah.
Something, yeah.
something like that, but I want to try to promote training to keep them interested in volunteering, so get them to volunteer by either offering trainings or anything,
Right.
just to keep them involved. 'Cause
Now,
I'm
the
su-
trainings need to cover the core competencies.
Exactly.
I don't know if you were able to look at that. But here are the training plan for all volunteers.
Yep.
In their core competencies, what each volunteer needs to do. And this is most updated from 2018.
Okay. Thank you.
Let me feel free to give you each a copy of the core competencies that are required for all the volunteers.
Thanks.
Would you like a copy too?
Sure. Thank you.
Yeah, I've been volunteering for 12 years. I think tomorrow evening might be the first one I'm gonna miss. That Chief Crapo has put together. I have a commitment till about 7 o'clock, so maybe by 7:30 I can come help
Clean up.
take down a table and
Cool,
put it.
exactly.
At least the weather looks like it's supposed to.
Oh,
be.
yeah, it's supposed to be gorgeous,
Box.
finally.
Not too hot, no rain.
Sure, this
So
is
at
helpful.
least with this training plan, it does have some suggestions on how you can meet each of the competencies for the volunteers. I know when the MRC coordinator position was designed 2 years ago, it was a 13.5 hour position. And some of the essential functions were to recruit, manage, and train the MRC volunteers, come up with the budget plan, maintain confidential background checks and all that through the Corey and Sori and the MA Responds. Did you happen to make a sign-out sheet for volunteers for tomorrow? So if
Yep,
anybody
I do
signs
have
up, we
one.
can check with
Yep.
them and then we can follow
Yep,
up.
I do have.
I know Nancy and I went through some of the supplies, and she
I
said that
also
you
went
went
through-
through the
yep.
rest of the supplies.
Yeah, last year there were a couple young ladies from Uxbridge, I believe. And,
This was the position
Oh,
from
yeah.
a
yeah.
few years ago.
but, it might have been slightly short notice because of all the time constraints I'm not sure when you sent out the request for volunteers, but,
It's hard,
anyway,
the summer's always a little bit
Exactly.
it is,
trickier with vacays and.
it is.
Were you able to get those supplies that Alyssa had for the MRC?
That'll list yes.
Yes,
that is-
from the,
yes.
from the GMA
Yep,
meeting,
yep,
yes,
Yep, we
okay.
did, yep, they're in there. You had
Okay.
mentioned that we put some in the,
Probably put them in the trailer,
Yeah,
so that's another
exactly.
thing we need to do. The
Exactly.
trailers have been moved.
Oh, yeah.
Both of the trailers were moved, and then the MRC trail, the GMA trail, one of them got moved back.
The
Here.
MRC one was in like.
yeah, that's.
The MRC one was moved back here. The GMA one, I think, they're supposed to both be down at the high school.
Okay.
So I know Tim had made arrangements for both of them to be, moved down there. And, excuse me, Tim?
Yes.
Do you know why one of the trailers was brought back up?
Claire needed it to fill it for tomorrow to bring it down to.
So that she's gonna take it, all right, so that's the one that's going down
Yeah.
tomorrow.
Today, and I think we're transporting it tomorrow morning.
Perfect. So those are the additional supplies. The other thing is, because now that the MRC trailer is going to technically be, able to go to any one of the 16 towns, then we probably really need to make sure that, the supplies in there, that we have inventory of all the supplies and figure out what's there. I don't know what's in the cabinets, if we can inventory it
Yep,
and get it into
we
the,
started to
because at
do
any
that, yep.
point, that trailer could get called to any
Exactly.
one of the 16 towns. It's no longer Grafton's trailer. It's any one of 16 towns' trailers. So we have to make sure that, it doesn't have, any of the, GMA supplies or the CERT supplies and stuff in there. That was the only thing I had.
If I have anything.
Do you have any questions of us?
Yeah.
No, just, I appreciate all your support that you can offer to me, and I definitely will reach out to you if I have any questions, and,
Great. Good luck.
thank you. Thank you very
Good luck.
much.
Anything? All right. Thank you.
Thank you.
All right, so we'll hold because we're early,
Oh, yes, okay.
because Kevin's not here yet.
All right. So I would like to nominate Keith Elms as the alternate animal control officer.
Is it inspector or animal control officer?
It says inspector here, but,
I thought she updated the agenda to say
Oh.
inspector, not animal control, 'cause that's animal control now
Okay,
is
then let me get, do I
regionalized.
have a different
No.
agenda? Alternate animal inspector.
Because I know she updated the agenda specifically to change
Okay.
that.
Animal inspector.
There you go. Hey, we want to have the right nomination, so we don't have to renominate after the
I can
fact.
second that, but could we discuss it? Or should we discuss it first?
If you want, discuss.
Sure,
it
we can
first.
discuss it,
I'm
yeah.
just curious who Keith is and if someone else had that position, or is there a change in, do you know, in the animal inspection? Maybe it's the animal officer or something, or something, because,
Isn't it
There
John?
were two people before. There was one
Well, there was animal
regular
control
and then the animal
inspector of
inspector.
animals. Yeah,
Right.
which,
so animal control went regional.
right, okay, that went with like Shrewsbury, Westboro.
Yeah,
Right.
Okay, so this is different.
yeah, this is the inspector of
Okay.
animals.
And where is Keith from, do you know?
I do not know Keith. Keith is from Maple Ave in Shrewsbury.
Okay.
And he must have an inspector's license, I imagine. And all that's necessary for that position.
He will occasionally fill in for Melinda as she is away. So the inspector of animals is Melinda from Westboro.
Okay. So they're sort of involved with that region.
Yeah,
Yes, and Keith will fill in
okay.
when Melinda's away or unavailable.
Okay, well, I'll second that motion.
All in favor?
Aye.
I
Aye. All right. Do I need to
I
sign
think
it?
you need to sign it.
Name, that's him. All right. Appointment, oh, that's animal health. Maybe, is this the one I don't sign? Hold on. Nominating authority. Inspector, nominating, no, that's just printing out stuff. Acceptance, that's him signing that.
Right.
And that's a notary,
notary.
and that's the state, so this is, we just
Right.
make a motion. I said, there's one form that comes up every so often that I don't actually sign.
Right.
Or no one, I should say, sign.
You
not
don't think
just
sign?
me.
Okay.
No, I just looked and there's nothing on there that's for me or anyone on the board to sign.
Okay. I have, a permit for Christopher Roney as funeral director.
All right.
Yep.
FYI, the funeral home is getting a, dog. A
Sympathy dog,
sympathy dog or
Comfort dog.
comfort.
comfort dog, and, yes.
I've heard about it, I just,
So they have a dog that's currently in training.
It's very nice.
from what I've read, it definitely helps out
Yeah.
in the stories I've heard from
Yeah,
other
it's
places.
quite a value to that.
We have
I would have appreciated
one at the hospital. We have one at the hospital that comes and visits some of the oncology patients
Oh.
once a week. Hops up in bed with little old ladies and
Oh.
makes a big difference.
Yep.
I have no minutes.
Is that back?
Well, while we're waiting, I attended the meeting the other day. It was actually a very good meeting. Some of the suggestions they had, they did give out a PowerPoint on emergency dispensing sites. They had a few examples of various things. They did have a call-down list, a 24/7 call-down list. And the example they showed was Millbury Board of Health. And this was a good example because our call-down list, we just have the Board of Health members. This one actually has the Board of Health members, but then it also has, like Julie's name on it, it has the fire chief's name on it, the police chief. So it has a little bit of everything, all the other resources that you might need, the Title V, inspector, the head clerk, et cetera. So that was an example of a call-down list, so that's probably, a good example of what we should do when we update our list.
Yeah.
And then another example they had of a floor plan. So they had Grafton's floor plan as one of the examples. Let me see what else they had.
And we'll send out the, when we send out the minutes for that meeting, we'll send out the PowerPoint too,
Yeah.
so that everybody has that.
So they did show the Grafton High School as an example of,
Nice.
so that was great.
Always good to
At
be the
that meeting, we were also told that there were some additional supplies. So we were able to get some additional supplies for the MRC trailer. If I remember correctly, we were able to get some cones, some stanchions, some easels,
Sign kits.
and sign kits. So those were all the things, and Mary Ann, you heard her say that they did get picked up. So those are some additional things, from that meeting.
Yeah, the breakfast meeting last Friday of FEP, they did mention that they would like, the Department of Public Health in Massachusetts would like each town's Board of Health to be the leader in this, so.
Yes, that, the Board of Health has to be the one that's the leader for setting up the emergency dispensing
Right.
site, yes.
Stick around.
So I actually Western Mass MRC, they actually have a neat little video on, setting up an emergency dispensing site. They had done one, it looks like they used done at UMass Amherst
Yes,
College,
okay,
and had
yep,
students.
yep.
But it was 14 minutes little video, like, so
Okay.
for anyone who's really not familiar with an emergency dispensing site, it was a nice little, overview of the whole thing, which was great. The other thing they had done at the meeting was they passed out the hazard vulnerability assessment that was recently completed. Do you want to say more about that?
Sure. So essentially, proper procedure would be before you identify in a community or in a region what you need to buy for or trainings that you want to do or what you want to focus on, you do an assessment. So for the HMCC, for the Health and Medical Coordinating Coalition, they did a regional multidisciplinary assessment. So anyone from public health to hospitals, health centers, long-term care facilities, EMS, a survey was sent out probably close to 6 months ago, maybe. A survey was sent out with many questions, essentially looking for people to discuss internally and then respond with, what do you think we're greatest at risk for? What do you think we're most prepared for, least prepared for? What do you think we're most likely to have happen to us? Not, certain things, we're not prone to volcanoes here. But certainly there are other things, weather events or
Random Cape Cod tornadoes.
random tornadoes. It's always interesting.
Propane tank.
Yeah, I always remember for years we did this with the hospital. So just the hospitals we would do a regional. So each hospital would do their own, and then we would compile all the data into one regional hospital assessment. And it was really interesting after President Obama came to Worcester. One of the criteria on the sheet is like VIP, visitors, right? And so for years, it was always so low on the list because who of that, right?
That status.
But then President Obama came that year, and I forget, maybe 2015, I can't remember what year it was. And it was funny, the following year, hospitals had VIP escalated even just a little more right after that happened. So for this assessment, essentially what they did was they sent out a survey, they gathered all of the results, and then they ranked really what the top priorities based on all the data should be regionally to work on in terms of developing a training and exercise plan. So regionally, what should the group and the coalition be looking to do in terms of training or purchasing for the next couple years. So the idea is that it's backed more with data as opposed to
Conjecture.
just whoever decides it would be great to buy this or we should look at why, right? But there's a little bit of data and more thought put into it. So that's what that
So
document
then
is.
they came out with a 3-year training plan. The first year is on risk communication. So basically talking about communication, how we would message, have standardized templates, PIO training, which we don't have a PIO. Public Information Officer, the Web EOC, Code Red training, duty officer, etc. So that's kind of the first year. The second year is on responder safety and security, where we would do things like infectious disease training, PPE, active threat workshop, and infectious disease. So that's kind of the second year. The third year is incident management, basically making sure that people have had training in the ICS program. So those are some of the, things that they came up with. So I thought it was very interesting.
Yeah.
And it's great to have local public health and the municipality side included with like the healthcare institutions, right? And so for a long time it was just the hospitals did it together, and now it's also a new CMS requirement that all healthcare facilities need to do it. So you'll notice in there that all of the facilities that participated
I saw the names.
are listed because it's actually now a document that they could provide
names, okay.
to show that indeed they were a part of this process, right? And that it was a regional, because the idea is that it shouldn't just be you doing it within your town or within your hospital or long-term care facility, but you're talking to other people, right? So you're doing it regionally and really working with others as well.
And then the other thing they have is a vulnerable population assessment, which was really nice. It talks about each one of the towns, how many are below poverty level, how many people have no vehicle, less than a 9th grade education, over 65 living alone, no English spoken in the house, have one disability or have 2 or more disabilities. So it actually has it broken down for each of the towns. So that's, something we certainly can look at.
Is there a
For our town.
homeless category?
Not necessarily homeless.
Just curious.
No homeless, no vehicle. Do you want to know the percentage of people in Grafton that don't have a vehicle? Oh, only 0.8%. So, anyway, so it was, I found it very interesting that.
Good.
Yep. So, the other thing, that's all I have to say about that. The other thing on old business, while we're talking about that, we have a recent, I don't know if you've got to see the recent septic tank.
Schedule of
135 Westboro.
correct. And
Do we
it's-
have any idea when?
Yes, I, sort of.
Should I?
Yes.
I did,
I'm gonna
Yeah,
I'll
you
be
probably
sure.
should step out.
just
Yeah,
cuss.
doesn't hurt.
step out.
Yeah,
Just cuss.
just saw that. I'm like, yeah, it doesn't hurt.
I heard 135.
I guess we can't decide on anything anyway.
Yeah, it's
There's
not
only
like
two,
we're gonna-
oh no, there's 3 of us here,
Yeah,
okay.
there you go.
Yeah.
I'll be right. I'll be right here.
I did speak with Paul Conoyer today down at the sewer department to see if there's a schedule.
Okay.
And he said that they're getting close, but they can't do anything further until the developer that purchased land from the state on, I think it's Institute Road on one of the streets up there, is gonna have to put in a substation. It's pretty costly
Okay.
before they can proceed.
Okay.
However, it has to be done before the first of the year because, he or the company will lose their 50%
Ooh.
match from the state if it's not put in by the first of the year.
Okay.
And, so that's another delay. He did assure me, though, that, sewer work can proceed in cold and snowy weather. And, it costs a little bit more money to do that. It's more costly, but that should not be a deterrent. So what I'd like to say at this point is to see if Nancy could check, at my suggestion anyway, that Nancy could check with Chase Harris to make sure that they are on a quarterly basis at least, in addition to this removal of the septic tanks, also cleaning out the exterior grease traps. Oh, there's one of them, or 2 of them.
Yeah.
And then perhaps if Phil or Julie could check for the interior grease traps to make sure that they're being cleaned out on a regular basis and have a schedule or some kind of a calendar of when they do it. I don't know what you folks think about those 2 sort of safeguards.
Yeah.
Yeah, sure.
Yeah, where it's gonna take longer.
Right.
Yes, because we're well over 2 years now with the failed septic system, and I know I say that every single meeting, but
It's true.
it's been over 2 years.
But I think that would give us a little more documentation and assurance that we're trying to do the right thing here. So
Okay. I just made a note for them.
Thank
Should we
you.
put a motion?
Do we need a motion?
I don't think so.
No.
I don't think so.
No.
The one other thing that I had, going back to, the shingles clinic.
Oh, yes.
Yes.
So I guess the shingles clinic was a success and they had all their, people come. But after they finished the shingles clinic, they, I guess, miscalculated a little bit.
Okay.
And there's really not a whole lot of money left in the
Okay.
revolving budget for,
Dose
the
2?
flu clinic.
Oh, for the flu
Yeah.
clinic. Okay.
So I know we were one of the only towns that had signed up for a flu
Yep.
clinic this year.
Yep.
So,
Yeah,
And I think Nancy said the options. I'm pulling up
okay,
the email. Um,
so,
the option is we can ask the CNA of Grafton to see if they could give us
Community
the
Nursing
money,
Association.
but they don't meet until December.
Okay. And you guys usually do your clinic in September?
September, yeah, usually is whenever the vaccine comes, yeah.
Okay.
To try that, because otherwise we'd have to either not have a flu clinic
right, skip it for a year.
or try to find a way to get the money elsewhere.
Well, I know last year we were the only town that was doing it. All the other towns had stopped it. And we said we felt we needed to still do
It was
it.
fairly successful, too.
Yes, and so I'm wondering,
There's a little time pinch there, here though, so.
Yeah.
Um,
And then if we said, we asked CNA, they don't meet until December for finances,
Right.
and we proceed with it
right,
right,
under the hope, fingers crossed, that we get the money to cover it, and then we don't get the money to cover it.
unless they have the capability of having sort of a special meeting, even if it's, I don't know if their bylaws allow a telephone meeting or a vote or something, but we could maybe look into that over the next
Yeah.
week or two.
Yeah.
I suspect, I'm not sure about the math, but I wouldn't doubt that the shingles vaccine went up in price quite a bit.
From when they
for that-
first-
For the second dose, because they sort of had
Probably.
a captured audience at
Yeah.
that stage of the game. I can't think of any other.
Yeah, could reach out to the CNA, and at least it's worth a shot before.
Right.
Right.
they may be
Say
able to
no
say,
go.
yes. They may be able to at least give us an idea of yes, okay.
Right, depending
Okay.
on their funds.
Yeah.
What was the cost, do you think, of the flu clinic?
I don't remember.
I can ask
what
Pat.
it
I don't
was,
know, but I
yeah.
can check in with Pat.
And I don't know how much we ordered or what the plan was. Did we do 150 last year? Does
Yeah,
that sound?
150 doses.
But maybe we don't need to do 150 doses. Maybe we could do 100 doses or.
I'm just saying, but
Yeah.
is it in the update?
Sometimes.
Sometimes it
Pat
is. I
puts
know
it
she
in-
said that we've.
No, I don't
No.
see it in the update.
It's probably.
I can ask her for the cost and how much you usually order.
Yeah. And we can kind of look into that in the meantime, but I suppose we'd have to wait until our next meeting, which is cutting it close, but
Yeah.
Oh.
I mean,
we can ask Nancy to,
you can also, worst case scenario, have it a little later
yeah,
in the
Yeah.
fall.
We
if
would
need
definitely
to.
have to decrease
Push-
the number
push.
if we're having it later.
Yeah.
push it back a month or something, yeah,
Yeah.
okay.
Okay. Would one of you do me a great favor? And grab our other member out there in the hallway?
He told me he was in exile.
Yeah, well, he can come back
He's in
now to
hiding.
listen to listen to you.
In hiding. Kevin, I assume?
Yes.
All right, if you could, hi,
Kevin Shack, nice to meet you.
nice
to
to
meet
meet
And
you.
Daniel, I don't believe we've met either.
Nice to meet you.
Nice to meet you.
Right.
So I'm here to get Samantha licensed. She's been in my shop since May of 2017. Has worked very hard. I had an artist last year who didn't work out. He left, and I think we're a little bit better off for it. It just wasn't working out. And that's what we're here to talk about. There was one outstanding piece of the application that we hadn't done yet, and that was the first aid CPR. I brought copies of that tonight, and I told Nancy I'd bring it along.
Okay.
So I have copies for each of you guys. I can
Okay, perfect.
give to you now.
All right, so
Oh, and there was one other thing that we did not have in the application, and that is the vaccines. I had an artist in the past who refused the vaccine. I don't know if it's a legal thing, whether you can refuse it or not, but she said that she didn't believe in the vaccines. In this case, Sam's actually still breastfeeding, she may look like she's 18, but she's a mother of 3. So I don't know how she balances all this at once, but she is the mother of 3. And sorry to embarrass
It's
you,
okay.
but she is. When I
She
first
does look
met her,
18, yes.
I'm like, how old are you?
Keep that as long as you can.
Yeah, seriously, she's like wonderful. So yeah, so once she finishes that, I think it's probably a good idea to go ahead with the vaccine.
Yeah.
So, 2 bits of. You can punch me later.
Okay.
Now, what
Don't
about
worry,
the
like, no one
successful
listens to our
completion of a course, an exam on A and P?
Yeah, I talked to the inspector that just left.
Mike?
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 I'm
Yep,
sorry, I was drawing a blank on
that's
that.
okay.
Maybe I'm a little nervous. I talked to Mike about that. Quincy doesn't have the course anymore, which is
Oh.
No,
that's
but it
unfortunate.
is being
There's someone-
offered, and I'm blanking on who's offering it now.
In Greenfield?
Well, you're thinking of
There's a place in West.
West Boylston.
Okay, maybe it's the place in West Boylston that's
Yeah,
offering it. Okay.
And it was the owner of the shop who's putting on his own, which is strange because he's the owner of the shop and he's teaching
Okay.
the course.
Okay.
But there is another course that we found that was covering the same thing. We brought syllabus, we brought notes from the class.
Okay.
Okay,
They covered the same thing as the
It's the
Quincy course.
Quincy course.
I'm sorry. I don't know.
No, that's fine.
Thank you.
So if there's more, I brought Sam, no, I'm going to embarrass her, but I answer any questions you might have on the course too. So.
All right, so CPR is good, so we can check that off.
Yeah, and EED.
Keep
Yep.
a copy with the,
Okay.
with that.
And I'm sorry I didn't pass
Nancy.
it in all at once. It was just a timing thing. I found out there was a meeting coming up. I thought it'd be a great opportunity.
All right, so I guess the thing is, when is she doing the course, or is she,
She's taking the course?
yes, is she taking it now, or?
Yeah, it's part of the paperwork in the original application.
Okay.
I
Okay.
sent in the information with it.
I'm looking there now. Oh, skin course, okay. It's a CPR. Bloodborne pathogens.
And you live in town, Samantha.
Yes, it is.
That's good. Not that that's critical.
I thought it was nice too. It was okay. Yeah.
Alright, so any questions? So in terms of, if you're in the process of taking the class now, how long?
Are the classes a day-long class as the
Oh.
Quincy class was?
Okay,
It's completed.
And she said it's complete, yeah,
Okay.
Gotcha.
completed. Okay.
And then with the consortium too, I shared my notes from the Quincy's course, which I think was probably well known at the time. But on this, we could do the same. If you guys want to see what it was including, we'd be happy to do that to you. Give you that more information on it.
So basically, it's just the hepatitis B vaccine.
Right.
And we don't want you to stop breastfeeding just for that.
I'm sorry, like a month and a half. Almost there.
I'm sure you'll be relieved.
Yeah, it'd be nice.
So, do we have a recommendation then? It's everything except for, it looks like, the hepatitis.
Yeah, I recommend that we sign it and then, you know, as soon as we can get a hold of that hepatitis B vaccine certification or whatever it is, if you can forward that to us.
Definitely.
Yeah, I think it's, if it's within a month and a half, say 2 months, you take the first round. I think it's
Yeah, you have to take, yeah.
3 months later, so probably first of the year, if not a little bit later.
Yeah,
But it'd be good,
okay.
good just to
All
get
right.
notification of the
yeah,
first.
no, add it to the file, and
Yes,
that way it's,
absolutely.
All right,
Yeah.
Great.
you guys wanna sign that then? And I'll
alright.
put all this together. How's things working out at your new location?
Yeah.
Great.
Right, yeah?
Yeah, yeah. I took some time off and I don't know, like any occupation, before and after is really busy, and I'm paying the price now. It's all
Yeah.
stacked up.
That's why you
It's
always
like I'm
wonder if
like
it's
air
worth
traffic
vacation.
controller trying to get people in, but it's been great. It really has been.
Okay,
All right.
Thank you.
thank you.
Thank you.
Thank you.
Good luck.
Thank you.
So much effort goes into that. Makes you feel a little bit better about going to a place like that.
Yeah, well, you want them to know CPR and first aid. Not everyone,
Right.
you know, stays awake.
Yeah.
Do hear
And he-
people
yeah,
that like pass out or
And
something.
he uses all disposable,
Yeah. Because I remember we had all sorts
Needles,
of
we had all-
conversations
yeah.
when he first wanted to come into town to go over everything.
Mm-hmm. Makes sense.
all right, anything else under new business or old business?
Nope, not that I know of.
Correspondence,
No, I think I answered that. Let me-
mail, correspondence. I didn't look that far when I came in. This was just the letter to Katrina, FEP, saying that we voted to have Phil be the primary FEP rep.
Yep.
And then Mr. Daniel here to be the alternate.
Yep. Phil was on vacation, so I went last week to that meeting.
All right, that is it. No other mail?
Yep, so, okay, so next meetings, just since we'll roll off here, since 5 of them, September 9th, October 7th, November 4th, December 2nd, and then December 30th. Everyone get your, exercises ready for all of the signing in the December meetings.
And I guess as far as minutes go, we can,
There's no minutes here
so
for,
we can do that next
Yep.
month.
no minutes to sign.
Wish I had a rubber stamp.
Well, I'll make a motion to adjourn.
Second?
All in favor?
Aye.